Good afternoon, everyone. I'm going to ask folks to take a seat so we can start this next session. As people are taking their seats, I'm going to go ahead and introduce myself and kick us off. As you can see from the title of this slide, we're going to be talking about decision-making for both clinical decision-making as well as clinical trials decision-making. My name is Susan Apkon. I'm a pediatric rehabilitation physician at Children's Hospital, Colorado, and University of Colorado. I want to start by making a simple statement. And that simple statement is that decision-making is really hard. I had to get up this morning and decide what I was going to wear. And that should have been a pretty simple decision, yet twice I changed what I was wearing. And so when you start thinking about decision-making in the context of deciding whether or not you're going to start a clinical trial or a novel treatment for your child or for yourself, if you're an adult with Duchenne, I just want to acknowledge it's really hard. I also want to acknowledge something. We all just sat in this session before with three brilliant men who have led the field in Duchenne muscular dystrophy. And what I want to acknowledge is that all of us in this community have been impacted by the deaths that you heard about by one of the speakers.
Sure, could you open it?
What I want to acknowledge is how sad I am personally and sorry for the families of the boys that were lost. I'm sorry to the friends of those boys who were lost. I'm sorry for the care teams that were providing care to these young men. And I'm sorry for the entire community, those of you here today who are parents, who are grandparents, maybe aunts and uncles. If you yourself have Duchenne, I'm sorry. It was a devastating loss, and yet a reality that we're facing as a community. So I think today this talk is ever more important in learning how to make these decisions. They're so incredibly hard. You have to make the decision based on what you've learned about how the medication works. I don't know about you, but I was able to process some of what was presented previously, but not all of it. And I'm a physician who's been hearing this and talking about this for a really long time, and I still had a hard time understanding. So for those of you who are with me, give yourself some grace, because it's really hard stuff to understand. It's hard to balance the risks to the benefits, especially when there's limited data. Anticipating the unknowns when contemplating a newly approved drug or considering a clinical trial is really hard. Figuring out the logistics of what monitoring is needed for a particular drug or in a particular clinical trial is really hard. Even figuring out how you're going to get your kid to take a daily medicine or have a weekly infusion, or again, the lab draws required for some of the monitoring for some of these novel drugs is really hard. As a physician, when I'm talking to families, my job is to provide the information that you need to make a decision, answer the questions as best as I can, given the knowledge that I have on that day that we're having the conversation, because everything is changing very quickly. And then finally, my job as a physician is to support your decision. The decision that you make for your child, for your family, is the right decision. And it's going to be maybe a different decision that the family in the next room has made. But the decision you make on that day with the information you have is the right decision, and that's what I'm going to support. So today, you are going to hear from 5 individuals who are going to bring their unique perspectives. 3 are parents who are going to speak about their decision-making process, and 2 are men with Duchenne and how they came to making decisions about the participation in clinical trials. I'll start by introducing the speakers. First, we're going to hear from Maru Chapur from Ohio, and then Winston Choi from New York City, Chris Bennett, also from Ohio. I think one's Columbus and one's Cincinnati, if I have it right. Yep. Good. And then finally, some old friends that I've been able to get reacquainted with, Eli and Jonah Perez from Washington State. So with that, I would like to welcome Maru to the podium. Oh, actually, I think we've decided we're going to keep it more informal.
I'll do whatever
and
you
you're
tell me
sit.
to, but I'll sit.
Yeah.
First of all, you look amazing. So I don't know about your other outfits, but that's a good choice. So good for you. Second of all, I am Maru Chapur. Let me just say that I am from Argentina, so I speak Spanish. I have been approached by some people outside that speak Spanish, so if you have any questions or I can help you, please don't hesitate. If I can, I will help you. We relocated from Argentina 5 years ago. That's my family over there, my son Leon and my daughter Amalia. That's my husband, and that is in Iceland last summer. We went there for a trip that my son, after getting gene therapy, requested, and I obliged, of course. I can always say yes to that little man. But before that amazing picture where we are all smiling, we had quite a journey. I'm going to share a little bit. I hope you can follow up, because for me it is exhausting. I can't even tell you, I don't know how I did it. I found out that Leon had Duchenne muscular dystrophy in June 2019. I am not a physician. I was a journalist back home, so I don't know anything about medical, anything. So they started to explain to me what was that, and I met a couple of physicians in Argentina. They were okay, but they did all of neuromuscular diseases, not only Duchenne. So we went to a medical entity, and my son was sitting down with adults, kids, teenagers, a lot of everything. He was 5. He didn't like it. And I was devastated to feel like, oh my God, I can't help him. What is it that I'm going to do? Thank God for my mom. She did all the research. She did everything, and then the pandemic hit. And she came in my house in March and told me, Maru, you have to move to Ohio. I'm like, what? Yes, I will help you pack your bags. You get 8. You have to travel in a specific plane because pandemic. I'm like, what? Yes. So she actually did help me pack. And we left September 2020. I think it was the 5th. We arrived here in Columbus. Again, pandemic, I didn't know anyone. We landed with Dr. Mendel, of course, and we went with him. He's amazing. We love him. Everyone here knows about Dr. Mendel, and if you don't, you should learn about him because he's an inspiring man. So we were so lucky, right? We're in the right place. But then he retired. So I'm like, okay, this is not good for us. We screened twice for clinical trials. Nothing was happening. In the middle of that, I got connected to this amazing community, Pat, and some of my very best friends are here, over there. And I was redirected to another physician, which we liked. But at that point, my son was 9, already been screened twice and rejected twice. Not happy about going to another state for care. So I tried to tell him this is just what we have to do. And he's a very smart little boy, and he will always say yes to me, but then he has a million questions. So we went to out of state, we met this doctor, he agreed, he liked him. We were on board, let's do this. And then we got another choice. Well, there are 2 things right now. You could go for the clinical trial with this lab, or you can actually get the product with this other lab. And I'm like, I don't know. I think that the best decision that I made was actually trust my physician, because he helped me make this decision. Again, not a lot of medical questions, because I'm not a doctor, but what do you think will impact him? How many months do we have to relocate? What are the medications that he has to take? Like, how do you think he's going to feel? My son is very small, as you can see. He's skinny. I feed him, I promise. But he's very thin. So I'm like, I'm struggling. After gene therapy, he lost weight. But this guy, course, the doctor, right? But I mean, he gave me the peace of mind that I was looking for. And at one point, it just has to be a leap of faith, because I don't know, like gene therapy, and it's amazing that we have so many choices now, and that we have doctors that explain that to us. But for me, it was hard at one point, but easy another, because the hardest thing for us was just to find the right person. And the way we did that is to just have a place in the community of people that understand what you're going through. I don't have to explain myself to anyone here. I'm sure everyone understands what I'm going through. I probably thought about, maybe you didn't relocate from Argentina in the pandemic. Okay, I get it. But I mean, a lot of you guys probably have questions and move and go out of state for care, and you understand what it is. But I think that the most important thing for me is try to find the person that will help you and recognize that you don't have the answers. Even though you're a parent and your kids look at you for the answers, you probably don't have them all the time. My kids always, it's amazing how they feel this, because it's true, but I mean, they say this about me, like, Mom won't lie. So if you ask her a question, she will tell you, which is hard sometimes. And my son recently asked me, Mom, do you think I am going to die? And I said, yes, but I am too. I don't know when, so let's just make the most of every day and everything that we do. And I know it sounds like easy, and it's not. I want to kill him sometimes. But I don't know. I feel good about myself, and I try to make him feel about himself good as I do, and rely on the decisions that I made, surrounded by the people that gave me the tools to do it. Because I have no clue most of the time, but I'm happy I have friends to tell me, Maru, it's that way. It's great. So thank you so much. And if you have questions, English or Spanish, I'm happy to answer them.
Great. Thank you, Maru. Okay. So our child was diagnosed right after he turned 3. And I think, like it is for so many people here in this room, it was quite surreal. I actually got my photos in, or I didn't send my photos in, sorry. So no photos for me, apologies, I was late on this. So I think when he was 3, to the naked eye, he looked fine to me. We had actually gone in because of flat feet. So to somehow go from flat feet to a Duchenne diagnosis felt pretty over the top and dramatic, and obviously extremely devastating. I'm a journalist by profession, and with hindsight, I approached our quest for treatment like my job. So step 1 was report out the story, which in this case meant getting the lay of the land. Step 2 meant figuring out what was good, what was exciting, what was cool, what could work for him. And step 3 was getting it done, which meant getting him treated in a trial that felt promising, or getting him treatment that felt promising. And all the while, I felt like I was on deadline. So I'm going to tell you a little bit about that first year. It was a very, very intense year. So briefly, within the first day of diagnosis, we actually were already in touch with PPMD. We moved quite quickly. We found out within the first 2 to 3 weeks that there was a gene therapy trial for kids his age. That was, at the time, a trial for kids that were 2 and 3 years old. And we went through the kind of consent process. We had our screening visit booked. But for reasons that were outside of our control, that was canceled. And so that did not work out. And I will consider that strike 1. When he was 3.5, one of the gene therapy companies was running an antibody trial. And if you've been in this room already today, you probably know a little bit about antibodies. Essentially, this trial was just testing to see whether or not it would be safe for kids to receive their gene therapy product when they started their trial. So we did that. Needless to say, he had antibodies. That was crushing all over again. I'm sure a lot of people have maybe, or some people have been through that. It can sort of feel like getting your diagnosis all over again. You can feel the sort of walls closing in. So that was strike 2. Meanwhile, around that time, companies were starting to work on the second generation exon skipping products, which I don't know if that's been talked about yet today, but it will be over the course of this conference. And at the time, they were recruiting very actively for their exon skipping trials, all of which were focused on people with mutations in the hotspot, which is exons 44 to 55. That's probably like 40 to 60% of our population. But just my luck, that was not us. So also not an option. When he finally turned 4, he was eligible for some of the oral medication trials, most of which started around 4 years old. And, you know, antibodies don't matter for those. Mutations don't matter. I thought, finally, we cannot mess this up. There's no way to mess this up. Well, it didn't work out. So he declined to do one of the functional tests. He's very, very shy and quite non-performative. And in context, this was a new place, we'd never been there before, and he just wasn't feeling it. So he was excluded for immaturity and behavioral incompliance, which, to be his advocate, I would say 4-year-olds, that's kind of par for the course. But in any case, that was strike 3. We were out of options. So before I tell you what actually happened and where we landed, I've mentioned 4 things. We had the wrong mutation for trials, we had antibodies, we had an issue with the company policy, and we had quote unquote immaturity or behavioral incompliance. So those are 4 challenges. And through those 4 challenges, I learned a huge amount. And here are 4 lessons. This is maybe one of the most important ones. After your diagnosis, take your time. We did a huge amount in the first year. You know, one thing I was thinking about is that we say time is muscle in this community. We hear that over and over again. And I think that's kind of a double-edged sword, because on the one hand, saying time is muscle is important. It drives our community to action. It's great for advocacy. But I think for families, there's this like bell tolling. It's time is muscle, time is muscle. It's always the back of your head. And it's, for me, I think at the beginning, it was quite crippling to be thinking, like, I have to do something right now. I think in that first year, I was operating a lot on adrenaline. I was not thinking clearly. I was chasing and grasping at everything. And if I could do it all over again, I think I would have taken a step back, tried to stop and think for a moment, because I think in this, also in the situation we're in, right after a diagnosis, we are driven a lot by fear of decline, fear of the unknown, and so we rush into decisions. So I think, you know, listening to the talk that came earlier about gene therapy, I know at least some of the doctors talked about this, but taking a deep breath and thinking in the context of gene therapy is particularly important, just because, as they just said, it's a one-time treatment. So at the moment, with the technology we have today, if you get it, you probably, at this point, you definitely cannot get it again, even if something better comes along for your family. The other thing is it can also be exclusionary for other clinical trial options, even non-gene therapy clinical trial options, just because it doesn't wash out of your body the way an exon skipping product might, or an oral medication would. So I think that's quite important. My second lesson is just that there are, I think, age-related trade-offs. So I think age makes a big difference when you're thinking about opportunities. What's quite good is that on the stage here, all of us have kids who are different ages. I think I have the youngest child. So the way I think might be different to the way Maru thinks, might be different to the way Chris thinks, might be different to the way Jonah thinks, the way Eli thinks. And the calculations change, and your calculations will change too as your child sort of progresses, and as you as a family kind of figure out your priorities. And also new treatments are coming online all the time, and none of us can predict the future. The third thing, I'm just gonna echo what Maru said, which is having a great care team. You cannot make decisions alone, and having a team or a physician that can help you talk through your priorities, and again, in the context of this week, your risk tolerance, I think is really critical. I think, if anything, this week has kind of shown us that our risk tolerance, when push comes to shove, might actually be different than what we think it is in the abstract. So all that is to say, kind of echoing what Dr. Apkon said, just make sure you vibe with your doctor and figure out, together what your priorities are and what your risk tolerance is. And my final takeaway is just that there are no wrong decisions. Some decisions are going to be out of your control. Whether your kid has antibodies is kind of out of your control. Your mutations, out of your control. And you just make your decision tree and adjust as the chips fall. I think so long as you do your homework, though, and you're thoughtful in terms of figuring out your priorities, and you have a good care team, there is no wrong decision. Okay, and just to tie up where we landed, otherwise it's a really bleak story. In the end, we were able to try again for that same oral medication trial down the line, and I actually prepared, so this is maybe a tip for people with younger kids preparing for a trial. I actually talked to a Duchenne-focused psychologist who walked me through some wonderful tips. Hopefully she can share those at some point with PPMD. I shared her tips with the trial site, and it went smoothly. And he loves going to the trial. He was happy to participate in all of the functional tests. And knock on wood, it's going to go all right. So anyway, time will tell, but thank you for listening.
Maru and Winston, thank you for sharing sort of your comments. I'm starting to jot some notes down already and for follow-up questions. I do want to make sure that people know that we will have time at the end for questions. So we'll have all of our speakers continue. But so far, I think, Winston, one of the things that you said which really resonated with me is take time. Yes, we say time is muscle, but the reality is taking weeks or months is very, very important. And then from Maru, I learned, and actually, Winston, you said the same thing, kind of relying on others to help. Care teams, family members. Maru, you talked about PPMD and the community that you've made here and how important that is. So thank you for those words. Chris, I'll hand it over to you.
All right, let me first start from a place of gratitude. I'd like to thank PPMD for inviting me to the stage. And also I'd like to thank everyone up here. I do have my family on the screen. My wife, Marisa, and my 3 boys. Aaron is the oldest, Owen is the second oldest, and then Tyson is the youngest. And my 2 older boys have Duchenne. We were diagnosed in March of 2022. A week before our youngest little fellow was born. And so as you can imagine, it was a very tumultuous time. Kind of tying into the conversation, the dialogue that we're having, what is a framework? What are some thoughts that you want to do your best to anchor yourself in as you're thinking about a new drug, a clinical trial, a combination of therapies, et cetera, et cetera. And I will kind of articulate one simple man's framework and then bring you guys through the framework with an actual story that happened with our family. And so as I thought about specifically gene therapy, one of the things that we took in consideration was, what's the reward? So what is the benefit, the proposed benefit, the anticipated benefit? What is the je ne sais quoi of why we would do this? Is it having a body that can uniquely produce its own dystrophin? Is it being able to reduce the scar tissue in the muscle? Is it something that is supposed to, over the long term, assist with the heart? What is the unique benefit of participating in something, or what is the expected outcome? Always something top of mind. Why? Because that then feeds right into the second consideration that I think is important in the framework. What is the risk? What are the risks? And when I say what are the risks, it's not just in the studies, what is the likelihood of an unfavorable outcome? How much do I trust my care team? What type of community am I connected to that can provide support? What is the third piece I would mention? What is the hassle factor? And I'm just using a simple man's like hassle factor. How many biopsies? How many blood tests? If you are in a unique situation where you have children with and without Duchenne, how does the impact of participating in a clinical trial impact the rhythm of the family? Do we have to have spouses, significant others, partners split? Do we have to move? Those are all meaningful in the consideration set. And then I guess if I had to produce a formula, 30 reward, 30 risk, 30 hassle factor, I say that the last 10% is the most nebulous 10%. It is what's your instinct? What is the divine inspiration? What are you thinking? What are you feeling? To kind of give you some direction in a very fast-paced circumstance. Because to kind of echo what Winston shared, oftentimes it's not necessarily a wrong decision. You're making the best decision that you can make with the information that you're presented with trusted advisors at the table. And so with that framework, you also want to just empower yourself to position yourself not to kind of have regret or not be so anchored in the outcome. The quality of a decision is not necessarily driven by the outcome per se, but by the process you go through. And I think one of the things Winston shared that was just so powerful is that's why it's so important, especially as a newly diagnosed family, to give yourself a breath, to give yourself a moment. Because we've all been there where you get this diagnosis, you're managing your own emotions, you're managing what it's like to engage in the community differently, how to be honest with you, mourn what you thought life would look like for yourself, mourn what you thought life would look like for your children or your child. And so there is this impetus to go, to run. And if there's anything out there that can speak to that hope, I want to get in it now. I want to do it now. I want to be a part of it now. But giving yourself a moment to breathe, I think allows for you to be as objective as you can in terms of evaluating the reward, the risk, and the hassle factor for your family. So, true story. We have 2 older boys with Duchenne. FDA approves Elevidys for a limited age range of children. So what we had in our unique situation is I had a son who was in the range, and I had a son who was outside the range. And so we had a very critical decision to make, my wife and I, do we dose one son that would put the other son at risk of antibodies and potentially not having the opportunity to participate or have an option for gene therapy or this particular type of gene therapy. And, oh yeah, by the way, the clock is ticking, because my second oldest son is getting older and he's getting ready to age out of the range. And so at that particular time, we went through the model, if I can call it that, and we decided that we would be hopeful and wait. We knew that there was conversation, that the label may be expanded, and that the opportunity to at least be able to give both boys a shot at the gene therapy was worth it, even if it came at the expense of potentially losing out on just one getting it. So fast forward, the label is expanded. Both boys can participate. We start the process with A/B testing. And we found out, unfortunately, that both have antibodies and cannot participate in that particular trial. So as I do post-mortem, if you will, as we think about or talking about the decisions we make, how we arrive at those decisions, my wife and I sat down and honestly, if we were transparent with each other, we thought we made the best decision. And that's a decision that we could live with. Was that the opportunity or the chance for us to be able to get both boys an opportunity to receive something that could be helpful was the best decision for us to make at the expense of what would have been one over the other. So there is not any perfect options uniquely for us and our children, but we do the best we can, and we lead with love. And so I'm looking forward to hearing questions and comments. And I'm looking also forward to seeing what our good friends over here have to say, Jonah and Eli. So I'll pass it back to you, Sue.
All right, thank you, Chris. I think one of the last statements you said will resonate with me. You said, we do the best we can. And I think that that's, again, going back to this idea of you make a decision based on what you know at the time, you hear it, and you do the best you can. So, well, you know, when we were preparing for this panel, we had a phone call or two where we got to meet each other virtually, and then the last call, we were deciding who was going to go first and second. And interesting, the parents here thought that our openers should be Eli and Jonah. They should really be the star of the show. And ultimately, I think you guys decided that you wanted to be the closers. And for me, openers and closers, so when I got to know Eli and Jonah, they were younger, and we had a lot of sports banter back and forth. The three of us share a real love for sports, and so I'm happy to introduce the two of you to be our closers for the panel. Go for it.
Yeah. Okay, as everybody knows, I mean, what you can tell is we're twins. We're 26. And the picture over there, our dad's from Michigan, so we're Lions fans and stuff. Okay, so basically, we did a trial when we were 13. And at the time, we didn't really think about any of the things that the panelists talked about, because of course we were children. And so all we really wanted to do was help people and not have a muscle biopsy and stuff. And so basically what it was is we had to take Cialis, and we all know what it's for, but it was just to see if there was any added cardio benefits to it. And so we went to LA, and we would go to Cedar Sinai every day, and we would take it, and then we would just for the results to come, we basically would just hang out. We might play, like, at the time, the Lego Indiana Jones or something like that. And so after that, then they would examine us, and it was just like that every single day there. And it was pretty cool going to LA. Did I miss anything?
I think that's pretty much it for you.
Okay.
So most of our memories from that trip are mainly about being in LA. And we turned it into a vacation. And so we did all sorts of things. Went to a Dodger game, went to Beverly Hills, went to Rodeo Drive, went to the Coliseum, Natural History Museum on USC, or at USC. The elevator was terrible, but my brother also made some observations about traffic, and he thought the drivers had some, like, anger issues or something. Because of all you could hear. But the main point is that when you are thinking about what you should do for your kids and whether they should participate in a trial, and you go through all the things the other panelists said, sometimes it can be a little bit of a positive experience. You can turn it into a fun vacation, and so you have like a family memory and stuff, even though you are participating in a study. And like Eli said, we didn't necessarily have to think of all the different things that our parents had to go through, but we just, in the end, just want to help people and do something that can help other Duchenne boys in the future. And we didn't do that many studies, and that was mainly because our mutation is a little on the rarer side. We're duplication, and not just like 3 and 4, like somebody mentioned earlier in a question. We're like a really massive duplication from like 3 to like somewhere in the 40s. It's like a really big duplication. So, yeah, we weren't always eligible to participate in some studies, and at some point we stopped becoming ambulatory, and so then that's another thing where we couldn't participate in as many studies. But we always wanted to the best we could and stuff, and yeah.
Great, thanks, guys. I'm going to go ahead and kick off the question part of this panel with one question, and I'll sort of open it up to anyone. And I think maybe Chris, you talked a little bit about this, but how do you think about this risk benefit? Or I think you used the word risk-reward hassle factor, right? Like, can you talk a little bit more about that, or one of the other parents? I mean, I am one of the investigators for some of the clinical trials, and the hassle factor is real. And for me, as a physician, it's hard sometimes to describe that. It's hard for me to describe placebo-controlled, right? Can you talk a little bit about some of those things that you think about when you think about that risk-reward hassle factor?
I'll jump in to start, because I know we probably have wonderful conversation, but I do want to start by telling Jonah and Eli thank you, and also acknowledge his parents. They've done a phenomenal job. And I say that because my children personally are benefiting from the sacrifices of young men and women, manifesting carriers, who made decisions to say, we do not know what the benefit is. We're learning what the risks are, but we're willing to participate anyway, because it may do something for someone else down the road. So I just want to just acknowledge that and let you guys know they're so courageous, and I'm thankful for it. So I just wanted to say that. So now I'm trying to get back on track. Maru gonna get me, she's my accountability partner. With your question, when I think about hassle factor, I would think about keeping the main thing the main thing. And when I say that, meaning this, we have been divinely blessed with these children to raise. And that is the main thing. The main thing isn't necessarily to kill or destroy Duchenne, is to develop phenomenal people. So when I'm thinking about the hassle factor, I'm thinking about how much of this will disrupt who they are in a very critical time in their lives as they're developing. I'm thinking about how does this change the trajectory? Because if we're being transparent, especially with all the hopes anchored in what could be possible with gene therapy in particular, it's one thing if we're going to do, if that's what we're reaching for, or this is what we're seeking to respond to, versus we're looking at something that will make you more comfortable. And so that's where those needles start to turn. But I do think as you're thinking through the process, as you're evaluating, it is the main goal is for me to develop a phenomenal human being. And I'm leading with that. And so what will support that, what may disrupt that, and then how meaningful will the trajectory from what we are forecasting, we don't know, will be from participating in said trial, in said clinic, in said drug, in said therapy. But that's kind of where I start, and we just start navigating and knocking down the X's and O's from there.
I love that. I love that. So you and your wife have sort of established sort of your goal, and you've identified the goal is to raise good people, right? And that plays into the decision making. You know, when I talk about hassle factor, maybe it's the frequency in which they have to come in for labs, and maybe to develop a wonderful human being requires them to participate in after-school activities. Kind of making that up, but like, does that get in the way? Is that sort of, kind of what you're getting at?
Absolutely, and I use an example from another family I just heard this morning. Buddy, he's not in here, but I was talking to his parents, and one of the things that his mom was highlighting is that one of the things they took in consideration for one of the things they were considering was his ability to be able to ride the bus to school with a group of friends he had made in kindergarten. It was important for him to be on that bus in the morning going to school. So much so that when they were sitting down with the principal of his school at the time, and they were having a discussion and saying, okay, we think we're getting to the place where we may need to have special transportation for your son, she stopped the conversation and said, I can do that if you can grab his 9 friends and put them on that same bus. Because for her, it was important for him to have those social connections and friendships that have lasted 35, 36 years. So much so that he was just at a wedding for one of those friends he was riding that bus with every day to school. So making a decision to kind of have that as your focus will help guide you in those decisions.
Love that. Winston?
Echoing everything you just said, Chris, very well put. 2 follow-ons from that. One, and I don't have siblings. Siblings may not have come up, but I think thinking about siblings is really important. I think one thing, especially certain trials are more onerous and in some cases require relocating. Does that mean that you have to split your family up? I mean, that seems, maybe it's maybe it's worth it, but maybe it's not. And so I think thinking through kind of the effect of trials on siblings. I mean, maybe the sibling's young and they can come on trips, and it can be, you know, I mean, we travel for the trial that we're participating in, and often we bring our younger daughter as well, and it's, you know, we make it into like a family vacation. But I think that's a really important consideration, is sort of whether or not you have to separate your family and how much it's going to impact your other child. And the second thing is a piece of advice that Pat Furlong gave me when I was spiraling that first year, which was don't over-medicalize your child, or don't medicalize your child. They're your child. They're not your patient. You're not their doctor. You're their parent. And so I think that's a really, that's something that is worth keeping in mind before you sort of begin signing them up for everything.
Great, thank you.
I want to add something. I am amazed because I struggle a bit. As you could tell, I have barely an accent in English, right? And I hear Winston talk, and she's so smart, and Chris is like that's the only thing I want to do, right? He knows what he's doing. He is driven. He knows, right? And I was thinking while I was listening to them, how hard it was for us to make the decision. Like I didn't even think about it. I was just in the plane, and then I came here, and I had to Google Columbus. No offense, because I didn't know where it was. And I got there, and I got to meet so many people that helped me up from the floor, because that is what I was there. I couldn't do anything, and I'm talking to you. I'm like, who wants to listen to me? Like, I was barely, and now I'm here, and I'm happy to help if I can. The only thing that resonates in my mind, what they were talking, is like, was it worth it, right? Was the trial like all the times that they say no, and he listened, he's so smart, that dude, like he will know, and he will look at me, he will, this disappointment, right? And do you still want him to be a kid? Yes, because that's what he is. He's a kid. He's not Duchenne, he's a boy. He wants to play. And I think about how he's doing right now, and when we got back from the place that we got treatment, that it's not Columbus, he asked me for a bike, and I'm like, and I have a good friend in Columbus, Amber, that told me, you should get him the electric trike. And I'm like, what? Okay, and I live in Worthington in Ohio, in Columbus. If you ever go, it's like nothing ever happens. So it's very safe for him to go outside. So he wanted his bike, and I'm like, okay, I'm so cool. He will get a little air tag, and I will know where he is. It's not live, the air tag. So you cannot know where he is all the time. So I got him an Apple Watch, and now I know where he is all the time. But still, he gets his bike. He comes from school, gets his bike, puts his helmet, the Apple Watch, he's gone. And he comes back at dusk, like a regular 11-year-old boy. So is it worth it, leaving your family, your country behind, your traditions, your language? I don't speak English. Is it worth it just to see that little bird's face? Yeah. Is it hard? Yes. Surround yourself with the people you can trust. It could be a friend and a beer. It doesn't have to be Pat. I know she's enormous, but I mean, right? It could be anyone that is struggling and has the same fear that you have. They will understand. This community is awesome.
Yes, this community is awesome. What I'd like to do is open it up for questions right now. There are microphones in the aisles towards the back. If anybody has any, I'd like to welcome you up.
Of course, no questions. Chris explained everything.
Looks like, Eric, you have a question?
Yeah, I think, well, first a comment that I heard, I mean, from all of you that I think is really, really important is that there is no, one perfect path for any family, and that's going to be really individual decision making, and especially too for those who may be here first time at conference, as we go through all of these, investigational products, I think it can feel like to Winston's point, kind of this need to sometimes jump into this stuff, and it's okay to take time. My question though was, so as we're talking about kind of this decision making from the family, what's right for you is, how do you, as different ages of your children, for Eli and Jonah, you were 13 when you kind of started in the clinical trials, like how are you thinking about incorporating, how your child feels about maybe going into these clinical trials, into this decision making within the rest of the family?
I ask him, like my son is 9. Well, he was 9 when we started. He's going to be 12. So I just ask him, and we talk it out in the family. There's no taboos. Like my daughter will pitch in, and she's like, "Where are you going?" And she will Google, like, "Oh, there's something I want to do there." I'm like, "Are you coming too?" Like everything is very open. And as I told you before, my kids apparently think that I don't lie, so they ask. Right? This is what I want to do or not. And I will ask him also, like, Leon, do you like that doctor? Do you like the other one that we did before? And he will tell me no, yes, or whatever he smells. Or he will tell me everything. And I think it's great that we give them the chance, because at the end, it's his body. Like, yeah, he's a little boy. And he will look at me all the time to reassure that this decision that he's taking is the right one. But I will give him that choice anytime I can. He has to not make any of other choices. Like if I could give him that choice, I will every time. So I just ask him, do you want to? Do you want to? He was, I don't want to travel this time. And I'm like, well, I can't reschedule, so it's now or in 3 months. And he's like, okay. But he will tell me.
And I will echo that. I think it's so important creating an opportunity for your children to develop their own sense of advocacy, because for me, as I think about my two older boys, I want for them to see, act, do. When I say that, meaning that, okay, what questions is Dad asking and why? And I want to create space for them to say, why you ask that question? Why are we here so long? They asking it anyway. You guys know how the chatter boxes are. But creating an opportunity to let them know it is okay for you to be inquisitive. You should be asking questions, and ask it until you get a level of your own understanding. And because this is all about preparation and development. And then as they get older, the hope is that when I'm not in the room, when Mom's not in the room, that they are first getting a sense of trust in their care team, or whoever they're having to engage with. And I see it as a life skill, not just in the hospital room or the clinic room, but in law school and in college, getting a sense of the atmosphere of the room, and then engaging in their own critical thinking to then say, okay, I feel okay with this to do X or Y. But I think early on, because Maru hit it on the head, it's like, what you want to do, Ma? What we doing? It's one of those. But it's being intentional, creating an opportunity for them to advocate for themselves.
Yes, please.
Thanks. So Maru, when you first get diagnosed and they tell you not to Google, they're talking about don't Google Columbus. But my question is, I'm really glad you have this topic, especially it's so relevant right now, where all the headlines either want to focus on parents fighting for access to new therapies, or people complaining about the sponsors not providing enough information. How do we amplify the middle of parents and patients really need to be comfortable with their choices, understand the risk reward, and kind of really find that balance? And I think, Chris, you had such a great framework, but how do we kind of push it out and try to make that more mainstream, make sure parents are going kind of through this thought process?
I'm not answering that.
Chris, you want to take that
what
one?
you say? So I will start. I think especially given that time, that comment and that question is so important, especially with what has just recently happened in the last 2 weeks. I think it's important for us to stay grounded, first in our unity. When I say unity, that we are collectively seeking to find a cure for Duchenne. We are collectively seeking to find answers where there are more questions. We are collectively doing the best we can for the benefit of all these children impacted by a genetic disease. So I start with that as a foundation. And so I always say, let's keep the main thing. What is the goal in mind? So starting there. 2, being more process-centric, and this is, of course, all up here, being practical, dad, being more anchored in the process than we are the outcome. Good outcomes are great, bad outcomes suck. But the critical part of it is, do we understand why? Is there an opportunity for more standard protocols? How do we take an experience and build it into something that can be constructive? And I think sometimes it starts from a place of wanting to be optimistic and being hopeful and saying, okay, we understand that we have more questions than answers. We understand that there is a level of risk right now. We understand that in some ways, we're at a very exciting time as we start thinking about new therapies and new things that can do things that historically had never been possible or even thought about. And while all those things are true, on the other end, equally true is we still don't know what we don't know. We're still doing what we think is best, but are not always fully clear. We're still, in some of these, we're still talking about what the short-term implications are. We have no idea what the long-term implications are. And so I think starting from a place of grace, stepping into a place of unity, and then staying focused on a collective approach to do something good for our children is, I think, where the conversation we can kind of maintain, because there will always be differing opinions, other ways we could have thought about it, things we maybe should or shouldn't done. But I think if we stay grounded in that place, we can collectively navigate it. It ain't gonna be perfect, but we'll get there together.
Great. Thank you, Chris.
Thinking systemically, though, well, firstly, I just want to say, to echo what you were saying, one of the wake-up calls maybe of the past week has just been humility, that we don't know a lot. Like, we think we know, there's a lot we still don't know. And so if in your framework, which everybody's now latched onto, this is the risk part of it that we're still working through. I think I don't know if there are many physicians in the audience, but if we're thinking about how we move, I think physicians are a huge part of this in terms of how they talk to families about opportunities, and whether physicians are able to kind of employ a sort of structure and framework like the one you described, I think will be a huge part of, where families end up looking for resources and how they approach decision making, just because it's very hard to come up with this on your own when you're day one or week one or month one rushing for some sort of thing to grab onto. So having physicians, I think, participate in forums like this, or a way to kind of have physicians kind of think through frameworks like that with families as they go through a new diagnosis in particular.
I want to say something before we close, because I think about this, because again, very smart people and people that have experience in me. When they told me all about it, I have no clue. So I think it's very important to understand what you're going through and what your child will go through in the normal wording, not doctor super smart that you can't understand anything they're saying. For me, it was like, I need to feel confident enough around this doctor and my son, because my son is going to ask me the questions after, to ask him, like, I know this is dumb, but can you explain it to me if I were a little toddler, because I don't understand. And he's going to have plenty of questions, so how can I tell him? Like, I was sure he was going to Google it at one point. I'm sorry, Scott, I had to Google Columbus. But my son Googled muscular dystrophy, and I'm like, I need to be ready for this, because gazillion questions, I'm going to come for this. And he came, and he was like, hey, Mom, I know, I think he heard me with my husband, of course. I know you were worried. I did Google it, but I didn't understand half of it, so we're good. Do you have any questions? Because I felt so proud of myself, because I was ready. I have all the answers now, because my doctor explained it to me, and I understand everything perfectly fine. No, we're good. So it's important that you understand what he will go through in a way that you really understand, because I can repeat everything about gene therapy, but I don't know what I'm saying. And I am not really understanding what is actually going to happen to your body until I do, and then I can really explain it to you. So I'm thinking there are no gray areas. You just have to understand, and the process is easier if you have a lot of information that you can actually handle, because there's a lot of information. I can't handle half of it, so that's why I have my people.
Yeah, I appreciate both those comments. I mean, as a physician who's having these conversations with families and kids, it's hard, right? The information gets pushed out so quickly, and there's so much of it. And for us to process it and then be able to relay it back to you as a family, or a 9 or a 12 or a 20-something-year-old is a challenge. But that's our responsibility. Like, that is our responsibility. I think we have resources. I think PPMD as an organization has done a tremendous job bringing clinics across the country together, certifying us, asking us to perform at the highest level. And performance should include being able to have these conversations with families in an honest way. And when we don't have the answers, be humble enough to say, we don't have the answer. We'll get it to you, or we're going to learn together. And that's hard. As a physician, it's hard to do that, but it is our responsibility. So thank you for reinforcing that. Have another, thank you, sir. Question.
Hi, yeah, so my name is Aiden Leffler, Dr. Apkon. I don't know if you remember me. It's been a while, but it's good to see you.
Of course.
Yeah, I just want to say thank you to everyone on the stage, first of all, for sharing all of your experiences. It's wonderful to hear from each of you, and I have a lot of respect for everything that all of you have gone through. If I may, I kind of wanted to just add on a comment that relates to the previous question. And I just wanted to say, in reference to maybe a parent or also a child who's browsing on the internet and trying to decipher these varied channels of information that are really hard to get through sometimes. I just kind of wanted to offer a suggestion in a way, which is that I think we're at a point where we've gotten through about a full generation who's been through clinical trials, who's often multiple kids in this group have been through up to 3 or 4 clinical trials. At this point, I've been through 4. And so I think when you're a parent, one really important source of information that you can go to is kind of trying to find these members, these boys who've participated in multiple trials who can kind of share this aspect of the nitty-gritty details. And obviously, a panel isn't necessarily the best place to share that because a lot of these are more specific. So I would kind of just offer a recommendation to look at these boys who have gone through the initial opening up of clinical trials and kind of figuring out how we can even manage a clinical trial in Duchenne muscular dystrophy. So I just kind of want to point out that I think it's really important to try to reach out and see what other boys have gone through, what specific experiences they've had, and kind of see what are the areas in which we can improve, what are the pieces that we want to know when we're going to do a clinical trial. So I just wanted to offer that comment, and thank you for listening.
That is outstanding, Aiden. It's wonderful to see you. It's wonderful to see you, and hopefully, I know that there's a lot of PPMD staff here, so hopefully people have written that down, Alexis and Rachel. I think having someone who has that lived experience, and that's why having Eli Jonah up here was so critical, because I, as a physician, can talk about what I learned from you as a patient, but I'm not in your shoes. And so having someone to be able to share that is just so incredibly important. I'm going to go ahead and just jump to this. Maybe back one. Perfect. So I'm going to just go ahead and summarize. First of all, let me thank all of you. I got to meet you a couple times virtually, and to meet you in person and to hear you tell your stories is really, for me, just so powerful. I know I have learned a lot, and I have no doubt that all of you have learned a lot as well. I think what we heard today is that the decision-making for an individual family is a personal one, and the one that you make will be the right one for you and your family. And it will look very different depending on who you are, where you live, what your ultimate goals are, your risk benefit ratio, and how you make that calculation. And so my hope for you is that when you make that decision, that you are comfortable with it, because you have taken in all of the information, and again, you've made that decision that's right for you. You're going to hear a lot this weekend about different FDA-approved drugs and clinical trials. You heard some earlier today about that. And I encourage you to talk to your neuromuscular team and ask questions. In the heat of the moment, sometimes it's really hard to think about what those questions are, so come prepared. Or have someone come with you. And I think, Maru, you talked about this. Your mom did a lot of that research, right? And she gave it to you. She helped you to sort of process it all. And I think we all process information differently. So bring a friend, maybe a non-family member that can take in that information maybe in a little bit of a different way. And then I think we heard Actually, Chris, I think you summarized, you thanked Eli and Jonah for their altruism, right? So while the study in which you participated, guys, ultimately did not show benefit, we learned a tremendous amount from that trial. And from all the subsequent trials, whether they've been positive or not positive, we've learned a lot. And so for you as a family, there are other trials that you can participate in that aren't necessarily drug trials. There's a lot of observational trials. There are a lot of non-drug trials, so exercise trials. University of Florida, I think, is a great example of that. So I encourage you to think about, again, weighing that risk-benefit calculation in your own head. And for you, the right decision may be research that's not drug-related. It maybe is more of an observational trial. And so with that, again, Maru, Winston, Chris, Eli, Jonah, thank you so much for sharing your unique perspectives. I'm so incredibly grateful.